So there are many treatments currently being utilized for many years in terms using a conservative treatments, using jaw exercises, soft diet, also physiotherapy in order to relieve the pain, and has really had a great impact on the quality of life of patients as well as on their psychological profile, as it is very difficult for patients to chew and have using the masticatory process due to pain in the joint. That can be combined with a pharmacotherapy in terms of non-steroidal anti-inflammatory drugs or using opioid in order to relieve the severe pain. Also, they have been utilizing arthroscopy by putting an optic fiber in the joint in order to find out what is the reason of this pain and flushing out all the toxins in order to allow for the joint to be more flexible to operate. So all these have been utilized for many years, but the evidence in literature regarding this treatment is not that great and has not been given a potential in order to achieve a very good clinical outcome. So photobiomodulation could be the answer and the potential treatment modality in these categories of patients. I'm not going to discuss the impact of photobiomodulation in terms of bone degeneration in the condyle or in the fossa of the temporomandibular joint. My talk will be more focused on more the musculoskeletal pain in the joint itself. So photobiomodulation, as all we know, that it has been known for many years before 2014 as a low-level laser therapy, light therapy, cold therapy. But in 2014, eminent professors in the field sat around the table and they want to give a better name for this kind of therapy and given a photobiomodulation. If anyone who is very new to this therapy, if the term itself, it really represents and reflects on the mechanism of this therapy. What do I mean by that? If you take photobiomodulation and break the word into three segments, photo is light, bio, it's new life, modulation is change for response. So this is really give us a little bit of a hint where I'm taking you. So in photobiomodulation, if you have any cell which is under stress related to disease or related into a trauma, you will have more what is called oxidative stress and less production of adenosine triphosphate, which is adenosine triphosphate, ATP, is the gas, is the power for the cells to proliferate and differentiate after it is shedding. Oxidative stress is a phenomena. It reflects on imbalance between the production and the accumulation of reactive oxygen species and the ability in the cells and the ability of the biological system to detoxify these radicals products. So just to give you example, what is the ATP is and what is oxidative stress is. If you shine a light of any source, what I mean by that source means light could be laser, which is LED, which is light emitted diode, which is not coherent light. I've shown that one on a tissue, injured tissue, and this photonic energy of that light goes into the tissue. Into this laser, it is sub-ablative, which means it is just warming. It is not cutting. That's what it is, the photobiomodulation. It really goes, the photonic energies goes through the tissue to really reach a target of a chromophore. And photobiomodulation, the photoacceptor here, it's the cytochrome C oxidase, which is within the cell of the mitochondria. So this is the understanding of the mechanism of action. It's basically the cytochrome C oxidase, which is on cell membrane of the mitochondria, is the photoacceptor. When the light being absorbed by this photoacceptor, there will be a cascade of cellular and molecular activities that can help in order to repair the tissue. And these activities are the adenosine triphosphate production, which is basically is the source of the energy. that helps into a proliferation, cell differentiation and proliferation, and increases the ability of the cells to fight if there's any trauma, and also to accelerate the healing process. The other part of the molecular activity is reactive oxygen species, which is what can modulate the activities of the transcription factors and also help to repair the cells and promote healing. The other component is the nitric oxide. Nitric oxide, it is a very potent vasodilator, helps to increase the angiogenesis, increase the circulation, so bring more oxygen to the cells in order to decrease the inflammation and enhance the transport of oxygen to the cells to help for repair as well. So this is our understanding of the mechanisms of the photobiomodulation. In 2014, Professor Arani and his team published a paper about the 3 discrete photobiomodulation mechanisms of action. So they say, okay, then we know that photobiomodulation helps in pain relief, helps promote and accelerate wound healing, and also it helps into the performance mechanism. So how that works with the light coming to the tissue, what is the photoacceptors, how that interaction between the photoacceptors in the cell as well as the light photonic energy. So there are 3 discrete mechanisms, one related to the regenerative mechanisms, and they found that the extracellular matrix is the photoacceptor that will increase the activity of a transforming growth factor beta. Whereas the performance mechanism, it's related, what I said a minute ago, is related to cytochrome C oxidase as a photoacceptor of the photonic energy. Whereas in terms of the analgesic mechanisms, there are different mechanisms in that, and that will be related to the cell membrane. So the photonic energy will be absorbed by the cell membrane, and that has action on the action potential of the C fibers blocking it, and also helps into the TRV1, which is basically is a nociceptor, what helps into detecting any heat as well as pain. So these are at the moment the mechanism of action of PBM understanding. However, I think we need further research to understand further how that happens in terms of the wavelength that we use. And we know that photobiomodulation worked with a therapeutic window of wavelengths along the electromagnetic spectrum between 660 into 1100 nanometer, where the optimal clinical outcome happens within this therapeutic window of the wavelengths. How that really can translate into temporomandibular joint dysfunction syndrome. So how that really impact the photobiomodulation in relieving the pain, as well as helping into promoting more of angiogenesis, as well as reducing the oxidative stress. Every disease we need to treat, we need to know exactly first the etiopathogenesis of that disease in terms of photobiomodulation and how that have been really impact and can help to override these disease itself. So in temporomandibular dysfunction, we call it syndrome or condition, because it's not a disease, it must be some contributing factors that happen into the injury to the joint. So before any treatment, even with photobiomodulation, trying to remove any predisposing factors that can contribute to this pain. And if that doesn't really relieve the pain, therefore we go for a treatment in of the condition. So there are 2 things happening when you have temporomandibular joint disease. It's related to mechanical stress and also the neurologic inflammation. If the mechanical stress, as the joint basically, as what we move, how we chew, it's really the condyle is really moving into the fossa in order to open and close our mouth. And there's a muscles of mastication allow us to do that, even help us with the chewing process. So there's a mechanical process happening in here. And in that respect, in patients with TMD, they have hypoxia. There is a debridement of reperfusions of the respiratory chain of the mitochondria there. So that leads to more of the free radical production. That causes the pain. So also in terms of the inflammation, there's a lot of a production of the pro-inflammatory cytokines, the interleukin 1 and 6, that really contribute into the pain and inflammation at the site of the joint itself. So photobiomodulation helps to decrease the noxious stimuli and blocking the C fibers, increasing more of the happy hormones like epinephrine, using the endorphin and decreasing the bradykinin and prostaglandin E2. That really helps to decrease the pain itself, and also decreasing the oxidative stress, increasing the ATP production that will help into the cell to proliferate and differentiate in the area. And also it helps to increase the collagen remodeling and the tissue elasticities in the joint and in the tendon itself, and also decreasing the inflammatory cytokines and decreasing the edema and increasing the lymphatic drainage, and also increasing the tensile strength of the muscle tissues. That's very important. So really have a great impact in order to reverse all the deficiencies that's happening in the condition. So in 2021, I conducted a systematic review and meta-analysis for me to understand what is the current research about the use of photobiomodulation in temporomandibular joint dysfunction syndrome, and also what are the results and where are the drawbacks in these randomized controlled trial, and how I can extrapolate the reasons and that happening, and also help me to establish a recommendation in terms of the dysymmetry, as well as the treatment protocols, as well as to look at what is the best study design we can formulate in terms of the how we assess this variable. The methods of assessing the variables are very important. So I published this paper in 2021 in the antioxidant journals, and I looked at 82 papers, randomized control trial, and published until 2021. And after really using a very robust eligibility criteria, I managed to select only 44 papers that I looked at these papers. So these papers, the 44 papers using randomized controlled trial in terms of comparing the photobiomodulation into the conservative treatment modality, and to see what is really the outcome of these two treatments together. So I found out that there are some drawbacks in these randomized control trial, despite the risk factor was very low. Therefore, I managed to withdraw also recommendation in terms of the laser dysymmetry, as well as a treatment protocol for this condition. The drawbacks that I could really share with you is basically looking at the trigger points. So if you're trying to irradiate the temporomandibular joint, we have to look at which areas we need to really trigger, in terms of we need to trigger the muscles that really have an impact on that. So they have the muscles of mastication. So majority of the studies have irradiated the masseter muscle, pterygoid muscles, and also looking at the temporalis muscle. And however, there are some of the very maybe couple of the studies have looked at the cervical muscles, while the others haven't really irradiated the cervical muscles. What I mean by the cervical muscle, looking at the trapezius muscle, the sternocleidomastoid muscle, and also the digastric muscle are very important, because these muscles contribute into temporomandibular dysfunction symptoms. So basically what I'm talking about the trigger and affected point, that's very, very important. The papers that I have really reviewed, they're much not being respected in terms of number of the trigger point and also the allocation of the trigger points. So trigger point and affected points are two different. Trigger point is where patient tells you, I have pain here. Where the affected, it's basically where is the originated from. And that's very important. It's like you have pain in the back of your thigh and really painful. And you think, okay, I'm going to irradiate that area where the patient's telling you the pain is coming from. However, the origin of the pain is the sciatic nerve. So you go further up, you go to the sciatic nerve, and that's where the roots of the pain, and that's where you should irradiate as well. So that's what is the affected side. So in terms of the TMJ, the muscles that need to be irradiated is the temporalis muscle. You have to irradiate where the origin and the insertion. So the origin is extraorally, you can irradiate, but the insertion of the temporalis is intraorally. So that has need to be taken into consideration. And also the pterygoid muscle, we have extraoral, and while the originated of the medial and lateral pterygoid muscles are intraorally. Looking at the masseter muscle is extraoral, and also you're looking at the cervical muscles, which are extraoral. So these are very important to take the location of the trigger points, and also looking at the extraoral, intraoral, and also looking at the muscle itself, how big the muscle is. You cannot compare the size of the temporalis muscle, which is like a fan shape, to the sternocleidomastoid muscle or to the pterygoid muscle. So there are really things you need to take into consideration with allocation, the number of the trigger points. Also, you need to take into consideration the thickness of the muscle itself. Some of the muscle could be very, very thin, some of them very, very thick, and also the composition of that muscle varies. Why I say that one? Because that will help you to understand which wavelength would you use. If you have a very thick muscle, maybe you need to use your power output should be more than a thin one, because that will help. However, also where it's seated, if some of the muscles are very deep-seated muscles that you need to really may apply a pressure deeper in order to travel the photonic energy on to reach the target tissue, while, for example, using the near infrared to go deeper, that can have a deep penetration that can reach the target tissue. So choosing the wavelength, choosing the power output, your dosimetry, very important to be taken in consideration, depends on your trigger point that you're trying to irradiate. Furthermore, I went into to formulate what I can get out of this low risk of bias studies to formulate a proposed suggested laser and LED parameter protocols. So in terms of using it, either using extraoral, intraoral, using light emitted diode, or using lasers, so you can use 660 nanometer. You combined it with that's LED. You can combine it with near infrared, or you can use solo the infrared or the red lights, and that could be extraoral or intraoral. The majority of the studies that I have reviewed, they use the combination of LED extraoral with laser. That found that it gives better optimal outcome clinically. And in terms of the cervical region, you can use in the trapezius and the sternocleidomastoid muscle. You can use the laser and LED as a combination that can help to get into more deeper seated muscle. And in terms of the treatment protocol, how often you irradiate the affected areas and the trigger points, basically it's about 2 to 3 times a week for 4 consecutive weeks. So basically you're looking at 8 to 10 sessions, that depending on the status of the pain. What I mean by that is chronic or acute. As we know, if it is acute, you might need less of sessions. Well, if it is a chronic, you need a longer treatment in order to achieve a better clinical outcome. So that basically have been proposed as well as being documented. So in order to conclude with my presentation here, that photobiomodulation, it is a treatment modality. It's non-invasive. It gives a better outcome if you're using the light-emitted diode as we're using the laser of different wavelengths, knowing exactly the knowledge how to utilize the dissymmetry is very crucial. So, so my advice is knowing the laser parameters, laser tissue interaction, and knowing which wavelength to use, which power output, how many times of the week, for how long. These are all collectively play a big role to reach a very better clinical outcome. With this, I would like to thank you all for your attention, and I'm very happy to take any questions.
Yeah, thank you so much, Dr. Hanna, for explaining that and how PBM can make such a big difference on the muscles. And I really appreciated, very few have addressed the fact that it depends on the thickness of the muscles as to the power and the wavelength and the area. All those are big factors on how deep one can go. As a matter of fact, I've also been able to see when people buy home units that they've been able to speed up the healing on knee pain because they can treat it daily. And that's something that is really something as well. In clinic settings, you're limited to those 2 or 3 times a week, but if it's a home basis. But thank you so much for addressing that. So I will try and bring across a couple of the questions. I'm going to ask Michaela here to help me with a couple of these questions. As a physiotherapist, please address the opposite side of pain as well, often more tight than the side of pain.
Right. Are you referring to the referred pain? Am I correct?
I think sometimes in just sometimes, yes, that's, and I also think that sometimes you may be working on one area, but you forget the other area is also affected.
Absolutely. That's a very good question. Always you have to consider the contralateral side as well, because the contralateral side has been compensation for a long period of time. In order to have the balance for that one, that should be taken in consideration as well for the collateral side of the, if you're treating the left, I think you might really consider treating the right side because it has been compensating for all that in order to have the balance after the treatment is completed.
And I guess another thing would be, you've mentioned a referred pain. So many people miss that. They might have a pain in their foot and they start just treating their foot, when in reality, they need to be treating up either the back of the knee or at the spine, because referred pain is, you can't treat the final area. It's where is the source of the problem? Can you explain that a little bit?
Oh, absolutely. I think what I reviewed this studies, always when I work, we always really work with the physiotherapists regarding the cervical plexus as well as the cervical muscles. As I said, the trapezius as well as sternocleidomastoid muscle, then the styloid, the anterior belly of the digastrics. And they're very important, maybe because the patient doesn't have pain on these, but they're contributing already into the temporomandibular joint dysfunction pain. So I think this needs to be addressed and should be irradiated in order to help to get an optimal outcome. Despite the patient doesn't have any pain there, might be that equally some people come up with a neck pain as well as they having pain in the back of the cervical region, and people think, oh, okay, then I think that you need an orthopedic or you need to see somebody specialist because this is a pain in your neck and also in the shoulder. But they really do disrespecting or out of knowledge in a way. The temporomandibular could be the one who's causing these issues and need to be addressed. So this is another thing is more referred to the cervical plexus, a cervical region, than also addressing the temporomandibular joint itself.
And I guess one other thing that I've discovered, and maybe you could speak to it, is the layered effect that happens with pain. And I've seen it over and over again where somebody, maybe years ago, they injured their ankle and then they're walking around with that ankle pain for years. And then their right knee, they stumble and they fall on their right knee. Now, all of a sudden, the right knee pain is there and they don't notice the pain on their ankle anymore. And then, they hit their head somehow and their neck is sore. And all of a sudden, the other problems have gone away. So they go ahead and start treating the pain on their neck. And all of a sudden that's gone. But why is my pain coming back in my elbow? And then they start treating their elbow and that pain goes away. And then years ago, a pain will show up that was there and that might've been their left ankle. So it kind of, can you talk about that a little bit?
I think that's very good thing. I think in a way, referred pain has been ongoing for a long time. For patients, well, we need to understand that temporomandibular joint dysfunction is part of the orofacial pain. And that has been well established and for the diagnostic criteria. So I think we need all to have well-established diagnosis and full investigations prior for us to kind of assign what is the best treatment plan for that patient. So this referred pain is very complex, very hard to know why it's happening, and it varies from patients to patient pain perception, and that it depends on even patient's pain threshold. But in terms of the mechanisms of the referred pain, is still very unclear.
Okay, so I would like to play a short video, and I know there's more questions that will come. So if you could just stay in behind the scenes, and we'll bring you back on in about 10 to 15 minutes. Okay. PBM stands for Photobiomodulation. Photo being light, bio meaning biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPower LED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help
promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPower LED Palm Series, can help you, please reach out to us and we'll get back to you as soon as we can.
So I'll just mention now a little bit about the products that we have. So we've started. So the reason why I have quite a bit of experience in PBM is we started 14 years ago. Oh, that's right too. We started about 14 years ago with this device here. And we learned a lot of things. And this basically has the same type of power as we now have in the LED versions, but the LED versions are a whole lot lighter and easier to use and don't require maintenance. So it works very, very well. So we have the classic here, which this device here is the lowest power that we have. And it's an entry-level device. The next device we have is the professional, and the professional, all of the units are the same size footprint or size in your hand, very easy to hold. And this one here, the professional has the two wavelengths, 660 nanometer, which is the very bright wavelength here that you can see, and 810 nanometer, which is the wavelength that you can barely see it, but it's more an invisible wavelength. And then we have the ultimate. This device here has the most power of the series of different devices. And then we have the brand new device, which is the Super Palm 1050 nanometer. Now this one has the 660 nanometer as well. Quite a considerable power, as we talked about, in the area of over 150 milliwatts per square centimeter, and that's over that large area. And then we have also 1050 nanometer, and 1050 nanometer is almost perfectly invisible. Well, you can't see it at all, as a matter of fact. And please stay with us to the end, because this is the one that you'll be able to win. Somebody's going to be able to win of those that are watching with us till the end. But anyways, this is 1050 nanometer, and 1050 nanometer allows us to penetrate even deeper because there's less losses in the skin. And so the big things that are different is the wavelengths that we have are more powerful. The area that we have is considerable. We have what we call the wall of light, which is a very even distribution of light over this whole area. So there's no, when you put it over a certain area, you can treat, as we're talking about TMJ and TMD, you can do a very large area. You can see how in this case, it's so even, you can see there's no hot spots on that entire area. So we have that, we have the 1050 nanometer. And the other thing is we have the patent pending on our cooling system on this. It makes it extremely light, so that you can hold it without being uncomfortable, and holding it for a while if you're holding it here or there. We also have a stand adapter if a person wants to get that separate item, but it just clips into a stand to treat the area. So we have the different palm devices. And then we also have our larger area. This device here is our mini canopy. Now, doesn't look very bright because that's the 810 nanometer. And this here happens to be the 660 nanometer. And it's, as you can see, so this can do a very large area. It's equivalent to 15 of the palm lights put together. That's why we can treat a whole area of a back or a whole area of upper neck area and that. And we've also added another device that we're working with some universities with. And this is a new helmet that we've designed. It has the equivalent of 10 palms inside, and we've basically made it for either the 810 nanometer or the 660 nanometer. And in this case, this device just goes on the helmet like this, and it's because of the energy that we have. I'll just show you this way. That's the 660. Because the energy that we have per square centimeter is what it is, the treatment time on this is extremely short. You're looking at 3 minutes. And we're looking at this kind of thing being helpful for brain issues, injuries, and other dysfunction, where it can be helpful, where you can get brain activity to improve. We're working with Shepherd University and their use of light with this, and some other universities as well, which I won't get into at the moment. But a great group, because they've already established a PBM for wellness and sports. So this is great to see that they have a strong initiative. As a matter of fact, if you go to pbmfoundation.org, I forgot to mention, anytime you can go to www.sunpowerled.com, as you see in the back here. And I would like to now just mention that we do have the promotional, as was mentioned earlier, that you can get $100 off if you purchase the unit by Monday evening and midnight PST. And also we have the possibility, if it's a little hard on the budget, we've got a possibility of 3 payment plans. So 3 equal payments. So I would like to now bring it back to Dr. Hanna for some more questions. And so Dr. Hanna, you're back on, and we've got some questions. Go ahead. I got to put on some glasses so I can see what I'm going to do. Oh, and sorry, Dr. Hanna, I'll just say one more thing that I kind of forgot. In dentistry, some people also want to do intraoral use. And so we have a snap-on adapter that allows you to use the same device and have focused light on the area that you want to treat. So that's something for the dentists that I know they really like, because to do some of the areas inside the mouth. And we're also doing an initiative with oral mucositis as well. And I've just missed.
That's very good to mention that. That's very useful.
Can you, would you be able to comment to, I know oral mucositis and the benefit of PBM?
Sure. I think photobiomodulation, as we mentioned, its mechanism of action is very effective in wound healing. And oral mucositis, if it is in pediatric or for adult, is one of the side effects of chemotherapy and radiotherapy. And that's very depleting to the quality of life. I have seen patients where I work in collaboration with UCL and Great Ormond Street Hospital, where is the children's hospital, for oncology treatment, and it's really depleting. Some of the patients, they cannot even eat if they are in class 4 oral mucositis on WHO classifications, that even 3 or 4 grade, they have to have a peg for feeding through their tummy. So it's very depleting for the quality of life. It's absolutely needs something to help them. The conservative treatment in terms of the mouthwash and all that diet kind of regime is not really very much helpful. I think photobiomodulation for oral mucositis is very, very effective. And I'm very privileged to be on the board of the WOLT, which is the World Association of Laser Therapy, with Professor René Jean Van de Soen and Professor Rani, and they have really, this group formulated guidelines, recently published paper about the guidelines for treating the side effects of oral mucositis, recommended dosimetry, and also treatment protocol. So it is very, very effective, and I look forward for the future to really have more of a very robust randomized controlled trial in order to standardize the dosimetry as well as the treatment protocol. Surely, a laser intraorally can be utilized by some of the patients if they have a cracks and very wound in the corner commissure of the mouth. It's very hard for them to open their mouth in order to get access to the laser beam. So extraoral approach could be another approach to take it to treat oral mucositis if patients have a very difficulty in opening the mouth. And that and taken into consideration, if you're doing extraoral approach, you have to take the optical properties of the cheek. As you know, that's very important. The thickness of the cheek, you have a dermis, epidermis, connective tissues, as well as you go into the muscles and to get to the inner side of the buccal and mucosa. So the light is traveling through a lot of layers in order to reach the target tissue. So you have to be kind of mindful regarding the dosimetry that you need to apply, taking in consideration these different layers can steal part of the power in terms of nerves, in terms of blood vessels. They have a chromophore, and light loves to have that basically absorbed by these chromophores. So you have to be very considerate regarding choosing the correct dosimetry in order to reach your target tissue if using extraoral approach. So that's very, very important. So that's taken into account. I think oral mucositis is very, very important for using photobiomodulation for that treatment for sure.
We, I haven't had a chance to discuss this with you, Dr. Hanna, but we got a new study that's going to be starting very shortly with a new device. This obviously, with the light power that we have, we can treat through that way, through the cheek, because of the power and the large area, and it's so even that there's no hot spots. But so we can reach the inside of and to the buccal. But even more easier treatment that we're looking at is a device that will be going inside the mouth, very thin, like a bite plate, and but it has almost the power that we have out of these devices. I have established another patent pending on how I can cool, because if you had this type of power inside your mouth, it'd be too hot. You would be burning your mouth in 15 seconds. And we've been able to figure out the technology, how to have something very bright, very even illumination in the entire mouth. So you don't have to have the person open their mouth wide to try and get a probe into the different areas to illuminate. And we got some real excitement on that because
that's very impressive. I'm very excited now to know more about it.
We do have some secrets.
I'm sure. Maybe when it is in the public domain, I would like to have a look.
I would love to have that separate discussion with you, because I think
absolutely.
it has
This is very impressive. Keeping the temperature under control below 45 degrees centigrade, it is really the key for using the light on different power output. And also that helps. If you can decrease the temperature, you might be able to increasing the exposure time and maybe decreasing the treatment sessions. So you're really going to manipulate the laser parameters in that in order to help to get into the optimal outcome that you are targeting.
Definitely want to speak more with you on that. Now I have a question. Now I know this is not exactly in the dental arena, but I thought it's this is a question from Dave. Hi, I was diagnosed with a Baker's cyst and did have pain behind my left knee. I had an ultrasound, X-ray, and no Baker's cyst seen. Finally, I had an MRI revealed a torn meniscus. My son has no pain behind his knee, but MRI has shown that he has a Baker's cyst. It travels in the family by the looks of it. His pain is in his knee. Does the red light therapy treat and actually heal these issues? Obviously, we have to say you have to talk to your doctor about these kinds of things, and we can't say a lot of things, but we can say that PBM could be very helpful. I've known some people that have been able to regrow their areas of where there's injury and reattach significant parts. I'm sorry, I'm not doing very well, but an example would be one of the fellows that we have a video on, he in a construction accident, while he was using a pickaxe, that's one of those with the long swing to it, and he hit some soft ground and it went right around and hit him in the top of his, just above his ankle, cut his tendon right off, and
Yes.
did a lot of surface damage as well, internal damage and surface. They reattached the tendon and they said it was going to be about 6 to 9 months for healing, the healing phase on that. And that, you know, he might start walking in 6 months. He immediately applied PBM 3 days after the injury, 3 times a day. And we can show a video of him walking in 30 days, walking around the parking lot without pain. It's amazing. So can PBM accelerate healing? Yes, it really can. And that's the neat part with whether we're talking oral mucositis healing in the mouth or whether we're talking other types of things. Can, from your knowledge, what about, and I know, again, this is kind of outside your field, but just what do you know about PBM and the new research that's coming out on Parkinson's and Alzheimer's and other types of brain? Can you comment to that?
Sure, I'm aware that Professor Hablin has been working on a transcranial light therapy to really for Alzheimer's, and also for another psychological disorders have been very effective to that. I don't have much of input in that research, but definitely they're showing a lot of very potential good results. So I think this could be as well the future for using, where I think they're wearing a Hamlet, and that basically is really shining a light and go into the brain, and that really helps. I don't have much of expertise in that or even knowledge in that at the moment, but I think there are a lot of work has been done by Prof. Hablin and has been really shown a very good result. Just wanted to make a comment on the earlier point that been raised regarding the joint pain and also the pain that he has in the knee. Just to say, if we have what we call the kinetic chain of the lateral joints, that including the temporomandibular joint, the joint in the knees, and also the shoulders, all these are interlinked. If photobiomodulation works on the temporomandibular joint, I can't see why it doesn't work on the knee itself. So because that could be just because we all wired in a very funny way. So therefore, I can think that the light can be useful for any knee injuries.
Thank you. Thank you. I'm just going to address another, there's a message from John. Thank you for asking about this new bike plate. It's not available yet, and it will not be one of the Palm devices, unfortunately. It's going to look very similar, but it's totally unique for that application. So it will be a separate device, but we'll keep everybody updated as we continue to move forward with our research on this. Oh, can you speak to using light? Another question, using light inside for prior to actual dental work. What kinds of things can PBM be beneficial for prior to the thing, or even to abscess teeth, to that area? What other areas of dental can light PBM therapy be useful for?
Oh, there are a lot of varieties of clinical applications in dentistry, as you do it in medical and veterinary medicine. In terms of PBM, and from my field, I do a lot of preoperative, before I take a wisdom tooth out for a patient, I would do a single application of photobiomodulation on the site of the treatment. I take the wisdom tooth out for the patient, and I do photobiomodulations after the surgery, and I close up, and then patient really has a lot of less pain and also edema after the surgical treatment. And also I do using the lymph node for lymphatic drainage. As we know, if you have any dental treatment, as a work has been done, you will have a soft tissue swelling, and this apart as a process of having any surgical removal of wisdom tooth or any tooth. So basically having a photobiomodulation extraoral to the lymphatic chain of the submandibular lymph nodes, that will help to really release the edema and increasing the circulation and then decreasing any post-operative edema. I use it for patients who are on bisphosphonate, which is, I'm not sure, which is, we know bisphosphonate is one of the medications that strengthen all the bones of the joint and everything, but really brittle the joint, the bone of the upper and lower jaw, with having what we call medication related to osteonecrosis of the jaw. So this is very important. So I do sessions before I take the tooth out for these patients, as well as subsequently to prevent any complications after a removal of a wisdom tooth for a patient taking bisphosphonate. So it is very using photobiomodulation to minimize the medication-related osteonecrosis of the jaw. So there's a lot of treatment that you can use it preoperatively as well as subsequently during perioperatively and after the treatment. That will help to really minimizing the postoperative complication. And also there are a lot of studies have been shown utilizing photobiomodulation as a preventive measure as well as a therapeutic measure for patients with oral mucositis. So you can do preventive sessions before the lesions of the ulceration appear. And that, as I showed, it's really minimizing the degree of the intensity of the ulceration if it happened after the treatment or during the treatment of chemo or radiotherapy.
So just more recently, I'd say over the last year, been able to see, I mean, it's up in this area, but it's in a different department, but how it can help with ringing in the ears. Had a number of people really helped, some immediate, some after a few days, but a significant improvement in the lowering of that noise that they're hearing. It's pretty fabulous. Another thing is the lymphatic drainage, as you mentioned, how quick that can happen. And one particular person, he was treating his ear for the tinnitus, and he treated his ear for that. And his sister noticed that this side of the face, which normally has very big bags under his eyes, and that his whole complexion and everything changed because the lymphatic drainage through the area. So it can really help with that. We have another question here. Oh, can PBM help to rejoice? Sorry, can PBM help to reduce joint clicking? And this is by Dobek.
Sure, absolutely, because we now go back to what is the clicking and crepitation. So the symptoms of temporomandibular joint dysfunction, it's pain, it's clicking, crepitation, which is the noise during opening and closing, during chewing. So all this, these are really symptoms happening during the process of eating, and that really can be reduced. And how that be reduced? Because as you know, why the patient have a clicking? Because the fibers of the muscles are really under very increased tension and inflamed. Therefore, they are not easy. It doesn't have any elasticity. So there's a lack of elasticity of the fibers. When you use photobiomodulation, reducing the inflammation, allowing the fibers of the muscle to be more loose, to allow the joint to open, to allow the muscles to open the mouth without having any clicking, because the clicking happening, if the muscles are the fibers are very tight, and you're trying to open the jaw. So these are really, really rubbing the fossa itself because of the muscles are under tension. Since you release the tension by decreasing the inflammation and increasing the tensile strength and also the collagen remodeling of the muscles, so basically that will help to ease the tension and allow the patient to open the mouth very wide without having any clicking. However, having said that, if the patient having a clicking, but at the same time has a deviation of the jaw to one side to then the another, I think at this stage you need to step back and think. Condyle, or there's any degenerative condition happening here, you might step back. Maybe I need to do MRI scan to establish this diagnosis, and upon that you can really see, can I use photobiomodulation for decreasing the degenerative condition that the patient is experiencing. So it really is very useful to look at what is the causing this clicking, and also looking at the condyle in terms of it is deviated to the right or on the left side during opening and closing. Yeah,
Well,
sure.
Dr. Hanna, I want to thank you. This has been absolutely fantastic, and we've got so many questions that have been coming in. I would just like to, at some point in the future, I'd like to invite you again, because these guests would love to learn more. And so you have a wealth of knowledge. You're gifted in this area. It's so wonderful to see. So thank you very much for joining us today. I'm just going to wrap up with a couple other things here. So we have had a winner. We have Melissa Wynn. Melissa Wynn, are you out there? I hope you're still there and have been listening in. You need to come on our chat and say hi, and we know that you're there. So if not, we will be drawing for a second name. So I would just like to say we're going to have each Saturday, we're going to have these seminars, and we will continue to bring on guests like Dr. Hanna to bring in new areas of PBM and how it can work. So thank you very much, Dr. Hanna. And I encourage everybody to go to www.sunpowerled.com, sunpowerled.com. And we would think of those that are in your near space, those in your family, those seniors that could really benefit from PBM. So we really want to make a difference around the world with light technology, and please join us in that. We can make such a difference. So thank you again to everybody. Bye for now.